First of all, I'd like to say I'm very glad that you're all here and that I really wanted to share my journey of healing to help others, and that so often the other people I've spoken to about PTSD have spent years rather lost and trying to figure out how to heal. And I wanted to be able to help others with what I've gone through. Okay, let's see. I guess let's just check the time. Yep, yep, it's after 10 o'clock, so we'll get going. All right. Okay, my name is Jean Kropper, and I'm in Sydney, Australia, and I'd certainly like to welcome you all to my webinar on how I achieved relief from PTSD. I wanted to share the self-care and the healing techniques that transform my life and that can help you too, even if you're experiencing daily challenges, which I've certainly spent many years dealing with myself. And to start with, on the workbook, the 3 biggest misconceptions that can sabotage your recovery: that the only things that can help with PTSD symptoms is medication and therapy. That's certainly not true. There are many other choices, and I'll go into that. 2, that you can't heal from PTSD. That's definitely a misconception, and you can. It's not a quick switch that you can turn to fix everything, but you certainly can heal from PTSD. And there is what's called post-traumatic growth, which is insights and learnings and increase in compassion and other things that are the good side, the learning from what you've been through. And 3, that I don't have much control over my healing. So that's another misconception, that we can take charge of our own healing and that there's many things we can do to improve our own well-being as well as to speed healing along the way. All right, let's go on. The big picture. Okay, the fill in the blanks in the workbook. When you're thinking negatively, you see danger and problems everywhere. It's very easy when things are bad to keep assuming that things are going to continue to be bad, and that's not true. That's sort of the rut we can get into. Stress hormones can impede calm, thinking clearly, and sleep. Stress hormones like cortisol and adrenaline can impede calm, thinking clearly, and sleep. And the next one, breathwork, turns down the volume on worry and anxiety. And I'll do a breathwork exercise during the session today, just to give you one of the specific tools that I have used. Then you can use grounding exercises to move away from spiraling thoughts, connect with your body, and come back to the present. And I'll mention more on grounding exercises along the way as well. Okay, as a preface, I'm not a doctor, a neuroscientist, an art therapist, or a psychiatrist. I will only talk about what I know, what I've experienced, and what I've researched. It's important that you do your own research to decide what's right for you. I'll share my own lived experience, information and insights from the healing practitioners I've worked with, and my research. What I'm sharing applies to adults. I've not researched children and trauma, though I helped my son recover beside me. I won't be covering the causes of PTSD, diagnosis, or medication, since those are outside my scope. In my experience, some doctors and health practitioners say that they're trauma-informed and that they're not. It can be that they know a little bit about trauma, but not enough to be effective in your treatment. From a fellow survivor, I went to an expensive registered psychologist whose advice was ineffective, superficial, and frustrating. So trust yourself. Try different practitioners until you find ones that fit. My goal here is to give you authentic, tried and tested advice from someone who's walked the path of PTSD recovery and emerged stronger. Like many people with PTSD, I had some really rough years where I just got through the days, one by one. Everything seemed a huge effort. I felt like I was separated from the world, existing in a thick fog, and could not quite reach out and connect with life. I felt like an observer and not a participant. It's a really uncomfortable place to be. Okay, Fill in the blanks in your workbook, the 5 steps to relief. I'm just going to name the steps here, and then I'll go into the different steps in more detail. Step 1, understanding PTSD and its common symptoms. Now, I'm going to try not to spend too much time there because I don't want to focus on the negative. I want to focus on the positive in this webinar. Step 2, innovative practices, energetic healing. And that's the real ways to genuinely heal from PTSD, not just manage the symptoms. Step 3, practical techniques for managing symptoms, because we also need to just get through days as we're going along. Step 4, self-care practices to support your healing and well-being. There are many things that we can do day to day that just support being okay and help speed up healing. Step 5, planning a healing journey. Okay, all right. Now, PTSD is a complex problem that requires a complex solution. I'll describe the symptoms so that we're clear what we're talking about, and PTSD is different from burnout, though many of the same healing practices will help. Educating yourself about what symptoms of PTSD and burnout are and identifying what symptoms you experience is a great place to begin. The symptoms can seem unrelated, vague. Many people may not know they have PTSD. I didn't know I had PTSD for a few years into recovery. I didn't really understand what was wrong with me. I felt ashamed I couldn't get myself together, that I had trouble concentrating. I had terrible insomnia and a lot of flashbacks, intrusive thoughts, a lot of bad dreams, and was really struggling. So I think there are a lot of people who don't get diagnosed and really struggle in that gray area in between. Many practitioners don't ask about trauma in initial interviews. You can bring it up. I didn't know what was wrong with me until 2 years into recovery. A great start to a healing journey is education, awareness, and just acknowledgement of your own situation. Second, recognizing the symptoms when they're occurring helps reduce their power. Simply saying aloud, this is a flashback. I'm safe. It's not happening to me right now, can help you distance yourself and step out of what's going on. It can help interrupt it. PTSD symptoms are generally grouped into 4 types: intrusive memories, negative changes in thinking and mood, and changes in physical and emotional reactions and avoidance. Symptoms can vary over time and vary from person to person. Okay, so we're talking about step 1, about understanding PTSD and its common symptoms. Okay, just going through these. Now I'm going to start understanding PTSD. Intrusive memories. Symptoms may include recurring flashbacks, unwanted, distressing, and vivid reliving of traumatic events as if it was happening. And this was one thing I didn't understand for a while that I think is important and that many people who don't have PTSD don't understand. I first thought it was just memories, and then I realized, from research, that flashbacks are your body going through the whole thing again, your nervous system acting as if it is in that dangerous situation again. So flashbacks are much more vivid than just memories. So that's why they have more emotional charge to them. Severe emotional distress or physical reactions to real or symbolic reminders of a traumatic event. So you might go by a place that something happened before, or a noise or a smell that can remind you of a traumatic event. Upsetting dreams, memories, or nightmares about the event. So all of those are possible. Okay. Negative changes in thinking and mood. Okay, negative thoughts. These are different symptoms of PTSD that you may have. And just to take note of what you are dealing with and what's affected you right now. And for me, some people have said, oh, isn't this really negative? Isn't this really distressing? In a way, I found it immensely reassuring that these were all part of PTSD. I wasn't crazy. I was making things up, and all these disparate sort of symptoms were actually part of what was going on and what my nervous system was creating in its distress. So just I suppose take these, just note what you're dealing with. Okay, symptoms might include negative thoughts about yourself, other people, of the world, anxiety about possible future dangers, memory issues, including not remembering aspects of the event or forgetting blocks of time. I spoke to a former police officer in rural Queensland in Australia, and she had big blocks of time that were just vacant. She just couldn't remember anything from those times. So that certainly happens. And that's a way of your nervous system trying to protect you from what you went through. Emotional numbness. Sometimes people disassociate or feel distant from things, and sometimes you feel more vulnerable or exposed. We can react in different ways. Difficulty maintaining close relationships, hopelessness about the future, feeling detached from family and friends, the sensation of being in a fog, isolated in a bubble, or disconnected. I remember for years I felt sort of like I was floating or surrounded by a glass box or something, where I couldn't quite connect with the world. It was a very odd sensation. Lack of interest in activities you used to enjoy, difficulty connecting with joy or contentment or loving. Okay. We're going to move right through these. Changes in physical and emotional reactions, being easily startled or frightened, a feeling of intense vulnerability, sweating, nausea, shaking, or tremors. Hypervigilance or hyperarousal, always being on guard for danger. I remember this very vividly, and sometimes I still go into that, where that is a sense of being charged with adrenaline and feeling like you always have to look around to make sure something bad isn't going to happen. And yeah, it's really important to have techniques to move out of that. Breathwork is one of the best ones to get you out of that quite quickly. So learning some breathwork techniques and some other techniques to get you out of that hypervigilance is really important, because you need to calm your nervous system. Okay. Self-destructive behavior, such as drinking or driving too fast or doing drugs. That was one thing that I was really careful about. It's like, whoa, take care of yourself. Yeah, and not do things that would hurt me. Disrupted sleep, difficulty getting to sleep, insomnia, not being able to sleep even when exhausted. Yeah, that I certainly struggled with for years. Trouble concentrating or brain fog, and this seriously affects the ability to work. Overwhelming guilt or shame, and that can particularly be from soldiers or people who've been in situations where they were forced to do things that they didn't feel comfortable with. Irritability, angry outbursts, or aggressive behavior. Okay, and then the last is avoidance. Symptoms of avoidance may include trying to avoid thinking or talking about the event, or avoiding places, activities, or people that remind you of the event. Okay, all right, we're going to let go of that, and we're going to move on. So just take a couple breaths in through your nose and out through your mouth. A few gentle breaths to just let go of that. Okay, we're moving into the more positive end of things. Okay, the limitations of conventional medicine. Let's move this up a bit. And I think this needs to be just a tiny bit smaller so that we can see the whole thing. There we go. Okay, all right. Limitations of conventional medicine. Recognition, I'm not okay. My doctor does not have the tools to help me. Conventional Western medicine does not have the tools to heal PTSD. I realized quite quickly that, yeah, that my medical doctor couldn't help me, and that Western medicine is not equipped to heal PTSD. Now, that's okay. Western medicine is terrific for heart surgery. It's great for broken legs. It's great for malaria or infections or many, many things, but it's not a practice that's going to help with PTSD. I realized I had little quality of life and that I wanted to change that. So first, now Western medicine can offer, say, hey, go to therapy or take some medication. Those can manage symptoms, but they don't provide healing. And I will go into that in more detail. I'll go into that in more detail. I saw that there was a need for alternatives to Western medicines and just sort of saying, how can I heal? And in understanding the importance of exploring complement. Yeah, I'm getting tongue-tied. Okay. How can I heal? Understanding the importance of exploring complementary therapies for recovery and just deciding I am going to explore my options. I knew that there were other ways of healing and I wanted to know what they were. Okay, next. Okay, so I was beginning my healing journey. Just move up a little bit here. Yep, okay. And for me, that was a friend of mine told me about a place called Heal for Life. And they're in Australia, a center that helps people recover from trauma. It's about a 2-hour drive from Sydney. And most of the time, many of the people who go there have dealt with childhood trauma. And that was not my situation, but their program, their healing week, was very reasonably priced and had basically all the elements for helping heal from trauma. And so their 5-day healing week was a big boost to starting to understand what was going on for me and why I was struggling and what my symptoms sort of added up to and why my nervous system was responding in this way to crisis. So yeah, the Heal for Life Foundation, and I've got the website there. They've got a really wonderful program. And the thing I like most about it is that all the counselors on the program have been through trauma themselves, and then they have trained to run the program. So it means that everybody there is genuinely trauma informed and that they've got lived experience. And somehow that made it much safer to go there rather than someone who hadn't been through trauma telling you what to do without the real understanding of what that was like. Yeah, and then the issue I wanted to address was managing symptoms versus healing. To me, those are quite different things. In Bessel Van der Kolk's book, The Body Keeps the Score, and he's one of the people who've done a great deal of research on trauma. He explains how trauma is stored in the body and that this stored tension must be released for genuine healing to take place, and that medication doesn't release that. And some trauma counseling or some therapy can release some of that, but there's energetic healing and a lot of the complementary therapies are much better ways to release that trauma from the body so you can do genuine healing. And my impression is that veterans, first responders, and healthcare providers simply don't understand that energetic healing practices are necessary for healing from PTSD and burnout. Western medicine is great for taking out of an appendix, fixing a broken leg, open heart surgery. It's terrific at solving those health issues. However, Western medicine doesn't offer healing for PTSD. Too many first responders and veterans aren't told and think that no help is available for PTSD. If all you're doing is therapy and taking medication, that will manage symptoms, but not do healing. So you won't get better. And yeah, that's not a good place to be. You'll always be stuck managing symptoms, and that's miserable, exhausting, and really soul destroying. Yeah, one of the crucial things is that you've got to release trauma from the body. And that was what Bessel Van der Kolk was talking about in The Body Keeps the Score. So if you look into his book or do other research on trauma, you'll see that that's very true. Now, energetic healing at first, I wasn't sure if it was sort of weird, wonderful, new age kind of a healing practice. However, some of the healing practices, such as acupuncture, are thousands of years old. And many other cultures have used these healing practices for centuries. So they're proven techniques. They're not something superficial or just new. Okay. Now, for me, there were healing practices that I'd never heard of. So I wanted to do some research to find out what they were and how they worked and to learn about them. So that's one of the reasons I wanted to share my information. There are many choices out there, and just to begin the understanding of releasing trauma from the body, finding these practitioners will really speed that healing. Okay. So after going to Heal for Life, I wanted to continue to heal and move on and put myself back together, and was figuring out different ways of doing that. Okay, energetic healing. Step 2. So in your notebook, this is step 2. This is really about beating conventional therapy's trap, not understanding that there are a whole bunch of different ways of healing. And yeah, there's some really powerful things about this. It's a body-focused approach, and energetic healing is different ways of releasing trauma from the body without reliving the experience, which is just, wonderful. In therapy is a different approach, but being able to release that distress, that hidden energy that you're carrying around, that charge, and release that without reliving the experience is a real precious thing to understand. These practices work alongside traditional methods to speed recovery. So obviously continue whatever medical support that you need and whatever medication that you need. This is something in addition to that. And research, find out what's available in your area or online. Ask what your insurance covers. Try out different healing practices, and you can negotiate fees. I'll talk about the specific practices in a minute. I found that many of the practitioners were quite willing to help and negotiate fees. I had practitioners who usually charge $120 a session, and they charged me $80 a session because I needed to come regularly to go through 6 months or a year's worth of appointments to heal. Empowerment, you can take charge of your own healing journey, and you can find practitioners that you trust and that you generally feel comfortable. Okay, we'll go on a little bit. Oh, and the other thing that has come up in talking to other people who've been through PTSD, there isn't one way to heal. That's the bad news. The good news is that there are many ways to heal. I think a lot of us have thought there's going to be one healing practice that's just going to solve everything and is going to make all the difference in the world. The truth is that there's many healing practices, and that each of them contribute to your healing. And you'll find ones that you're comfortable with. I went through many different healing practices and worked with many different healing practitioners over, the last 10 years. I first realized I was struggling and went to the Heal for Life Center 10 years ago, and just gradually gotten better, even though there are definitely leaps and bounds where I suddenly thought, wow, yeah, I can concentrate now. This is terrific. And I remember, oh gosh, was it about 2018? Suddenly I could sleep again. Suddenly I was falling asleep in 20 minutes, half an hour, rather than lying awake for 2 hours most nights. So there's it's really useful to look back periodically and see your progress and make some notes along the way. Keep a little notebook or a journal to share what you're going through or to dump thoughts in your head, because it's often, yeah, healing is gradual and it's hard to see the progress. Okay, exploring energetic healing practices. These are paid healing services, and you can find out what's available in your area or online. So some of things can be done remotely. Some of them you need to find a practitioner in your area. If you're in a rural area, you might want to go to a city twice a year and have a bunch of treatments. That's obviously things that you can decide to find out what's right for you. The first thing I did was acupuncture. I had a chiropractor who was also a kinesiologist, a naturopath, and an acupuncturist. And that was a really powerful combination of skills. And I loved going because immediately after I could concentrate beautifully. My head was clear, I felt present. Uh, my nervous system was calmed down, and it just felt so good immediately afterwards. And it was really nice to do something that really gave a sense of relief. And over a couple of weeks it would wear off. My nervous system would start going into hypervigilance again, but it was okay in the sense that I knew I was gradually retraining my nervous system to calm down. I was helping it to remember what calm felt like, and gradually your body learns what's that like, and then you can learn specific skills like breath work that you can get there yourself without the acupuncture. So acupuncture was one of the really good ones. And in the last, maybe about 5 years ago or so, they brought in really, really fine needles. So if you're worried about it being painful, I found that it really wasn't, that there's a tiny prick when needles go in, but a good acupuncturist use quite a few needles. And but when you see someone, do brief them on why you're coming there and all your medical history so that they can treat what you actually need them to treat. And it's quite important to share your background with a healing practitioner, because then they really know what they're dealing with. And if they don't seem to know what you're talking about, or you don't seem to connect with them, find another person, because just like any doctor or a dentist, there are good ones and bad ones, and ones who specialize in different areas. So you might try 3 and then find somebody who's absolutely terrific and works really well with you. Okay. The next one is TRE, or trauma or tension release exercises. Now, this is something that you can take a workshop in and then you can do yourself. So that gives you control of taking care of you. And trauma release exercises were developed by David Berceli, and he worked with thousands of people in refugee camps in the Middle East and in Africa, where he realized that these people could not access individual care. They couldn't access an acupuncturist or a therapist. And often culturally, that wasn't something that they would do in their culture. It wasn't something that made sense to them. But there were many, many people who needed to release trauma, and he wanted to find ways of doing that. And trauma release exercises, my best explanation, are sort of, there's ways that you move the body, and then it sort of, I guess, puts pressure on certain areas, and then your body vibrates and releases the stored trauma. It's nothing painful, and it's something that you can learn to do in a workshop and then just do it yourself. So, and I know there are practitioners that are online, and there's also a free course. So I know I've got that. I'll send that to you afterwards if it isn't in the PowerPoint. But trauma release exercises are a really good way that again, you can take charge of your own healing. The next one's called craniosacral therapy, which sounds really kind of freaky, but cranio just means head, and it's about working with the, I suppose, the brain, spinal cord, and the nervous system to release tension. And the way I explain it is that when you have stored trauma or tension, there are sort of parts of the body that are very tense and are sort of blocking energy moving through the body, because there's that cringing or that holding of tension. And so blood isn't moving through that area the way it should be. Those cells aren't getting oxygenated the way they should be. And your body can't function properly when there are those areas of tension and high energy and areas that are of low energy. And craniosacral therapy and polarity therapy help shift those blockages so that energy can move around the body freely and sort of rebalances you. Often craniosacral therapists are also qualified massage therapists, and massage is often covered by health insurance. So they may do a combination of the two and have that covered by insurance. And the same with acupuncture. Often acupuncturists have another skill that is covered by insurance. So if acupuncture isn't covered, they may also be a masseuse or a chiropractor or something else that is covered by insurance. So you can ask those questions, but some of these energetic healing practices can be covered by insurance, just depending on what you have. And I know I have acupuncture and massage covered my insurance, so I find energetic healers that I can go to and have insurance pay for a chunk of that. Okay, the next is therapeutic massage. Now, massage sometimes has a bad name. It can be associated with sexual services. There's also now a lot of people in shopping centers who do massage. My thought is that there's a lot of levels of skill in this, and the people who are in shopping centers, my experience with them, and I've used them at times, is that they give one massage to everybody, and they don't really tailor it to whatever you need. And they just deliver that massage that they know how to do. While if you find an individual therapeutic massage practitioner and develop a relationship with them, you can tell them what your medical situation is, what your symptoms are, what you're dealing with PTSD, and they can tailor their care to what you need and what you're experiencing on the day that you're coming to see them. So that's a much higher level of skill. You can also find people who understand PTSD and trauma. I have one masseuse who's been through chronic pain and knows a great deal about chronic pain, and she's very skilled and has a lot of other qualifications as well. And a second masseuse that I go to has worked in emergency rooms and has all sorts of other qualifications that give her a very high skill level that can really work with your nervous system in a lot of ways. And with therapeutic massage, it can help release the tension from your body. Feels good. And also it can help you ground in your body. Often with PTSD, you can get lost in your intrusive thoughts or anxiety or worry or sleeplessness. And therapeutic massage can bring you back to the present, bring you back to your body, and get you back in touch with your senses. And that can really help with sanity and being present in the world. Okay, so we've gone through acupuncture, TRE, craniosacral therapy, therapeutic massage, and polarity therapy has some things in common with craniosacral therapy. Now, brain spotting or EMDR, those are two different things, but both involve the eyes and healing. I spoke to one friend of mine, Margaret, who used EMDR, which is eye movement desensitization and reprocessing. For me, I just found it annoying. So with any of these practices, some of them will work terrific for you, some of them just won't. For me, EMDR didn't work. For her, it worked very well. So you need to be willing to experiment with these different healing practices and find what works for you. For me, brain spotting also works. And again, they're, I suppose, sort of odd, really, but they can be ways of tuning into parts of the brain that are storing trauma and releasing that. And brain spotting, well, when you look in different directions, you can stimulate the parasympathetic nervous system, which calms you down, or the vagus nerve. And yeah, in my meditative drawing workshop, I go into some of these specific practices to teach you how to do them. But brain spotting can be about looking in different directions until you connect with some sense of charge or emotion, and then diffusing it. So yeah, again, brain spotting or EMDR are another way of releasing trauma from the body. Yeah, and there is a free trauma release exercise workshop on their website, and I'll give that to you at the end. Okay, so we're done with step 2. That's terrific. Okay, now I'm quite curious if you do. Yeah, if you can just check in, I'm very curious to see where you are, where you're checking in from in the world. And some people have signed up from the United States and some from Australia. And so please just type in the comments where you are in the world. And if you want to add anything else, I'd be glad to hear from you. Melbourne, Australia. Okay. Thank you, Roy. Anyone else want to check in? Gadigal lands in Sydney. Oh, good. Okay, great. Well, thank you. Yes. Okay, I'll go on. Okay, let's see. And I'm glad you're all here. Okay, step 3, practical techniques for managing symptoms. And I'm listing 4 here. First is mindfulness. And for me, mindfulness can sound very woo-woo, but I'm meaning it in a very practical sense, that it really can be simple. It's about slowing down, noticing your senses, and practicing being present. It can be as simple as going out in your backyard and noticing the weather, taking a few deep breaths, smelling the grass. Today it's rained this morning, so I'd be taking in the smells from after a fresh rain, and maybe take your shoes off and walk on the grass and feel the grass. So tuning into the smells and the sounds and the sights, and just slowing down and let yourself really just drink that in. It can be about gardening or taking a walk, but just slowing down and being very present with what's going on with you. And even just doing that for 10 minutes can help calm your nervous system, move you out of your head, bring you back to the present and to your senses, and allow your nervous system to calm down, and can make you much more productive for the rest of the day. The next is grounding exercises. I'm not doing those today, but yeah, I include those in my meditative drawing workshops. Those are things where you're just tuning into your senses. And I mean, one of the simplest grounding exercises I was reminded of recently was putting hand cream on your hands, because you can notice the temperature of it and notice the texture of it. And smoothing it on your skin, you're noticing the texture of your skin. And just taking 5 minutes to do something like that can, again, bring you back to the present. And doing little practices like that can interrupt overwhelm, can interrupt anxiety, because instead of being in your head, you're bringing back your thoughts to your senses in the body. Another grounding exercise is simply tuning into the smells or sounds or sights around you and slowing down and taking 5 or 10 minutes to do that. Okay, creative expression. This was really one of the key things that I did in my own healing. And I found it really useful to do some drawing and to do some collages as a way of releasing. Sometimes I would scribble frantically or just make marks to just release energy. I might do a drawing to sort of forget the world and just focus on one thing. And I'd often do collages, just making images of things like saying, what's going on in my head right now? What's going on in my subconscious? And getting those sorts of things out of your head and onto a piece of paper can help you make visible things that you don't have words for. And it can be a way of stepping back from what's going on for you and getting perspective. And it's not about making art or worrying about what the finished product is. It's not about being an artist, but simply about a way of expressing yourself creatively and releasing what's going on in your head. And other people might do that through dance, to listening or playing music that fits your mood, and spending the length of a song just focusing on that emotion and allowing that to flow through you. It could be playing music and getting lost in that. Singing in a choir, which is one thing I do, which is very good for depression and anxiety. It gets you breathing. And also just learning to vent in healthy ways, whether that's running or drawing or dancing or singing or whatever it is. Finding some of those ways that you feel comfortable releasing emotions is a really healthy thing to do. Okay, the last thing here is that you can change your state when distressed with breath work. And I'll just show you one technique right now. Okay, let's see, just checking that I've got. Okay, yep, we're on step 3. That's very good. Okay. Okay, square breathing. This is we're going to do it together. And it's about breathing in to the count of 4. I'll just explain it and then we'll go into it. Holding your breath for the count of 4, breathing out for the count of 4, and then again holding the breath for the count of 4. And doing this, going around and around for just maybe 5 or 10 cycles can make a big difference to your day. And this square breathing practice is used in yoga. It's been used for hundreds of years. And it's also used by Navy SEALs before they go into combat, because under stress, they need to be very clear-headed and make good decisions, but they also need to be quite calm. So I will just stop sharing and we'll just do that for a minute. Okay. Hello. Okay. Okay, we're just going to breathe in for the count of 4, 2, 3, 4. Hold for the count of 4. And breathe out. 2, 3, 4. And hold. Breathing in. Hold. And breathe out through the mouth. Hold. Breathing into the count of 4. And if you can breathe through the nose, that's good. Hold. Gently breathe out through the mouth. Hold. Breathe in slowly, gently through the nose. Hold. And breathe out gently through the mouth. And then hold. When you're breathing out, think about breathing out as if there was a candle in front of you and that you don't want to blow it out. So you're just breathing very gently and slowly. And breathing in. And breathing out. And hold. And we'll do two more. Breathing in. Hold. And breathing out. Hold. Okay, last one. Breathing in. Hold. And breathing out. Wonderful. Okay, great. Okay, we'll go back. Okay, we've moved up to step 4. All right, we're making progress here. Okay, these are many self-care practices that can support your healing and well-being. So these can really make a difference to how you are in the world and just help your stability and your overall health and well-being. These are good for anybody to do. Uh, and yeah, these were all things that I really paid attention to. And I realized that the more I took care of myself, the faster my healing would move. So yeah, eating fruit, vegetables, and protein every day, skipping the junk food, trying to prepare your own food so that you have control of what goes into your body and you're not eating lots of additives or sugar and oil, but having some good healthy fresh food in your diet makes a big difference. Also pausing between activities and just checking in with what you're feeling. So if you find that you're getting lost in your head, to just pause and do some breath work for 5 minutes. And sometimes I just stop for 5 minutes between activities and just sit. And in speaking with a whole bunch of people on LinkedIn in the last 6 months, I found many high performing people really manage themselves like this. They check in with themselves. Uh, they meditate, they take naps, they do breath work regularly through the day. And it surprised me that, yeah, people really need to manage themselves to be high performing and realize that that was really quite a normal thing to include in your day. Get outside in nature regularly, even if it's for a 10-minute walk in the park, that can really help you feel well. Give yourself time without devices and distractions. Often it's tempting to have a phone or a TV or a laptop going. It's really important to have some time without that, where you're just doing one thing at one time and allowing your brain and your nervous system to calm down. Regular exercise helps release built up emotion or built up tension and just keeps you moving. So find something that works for you, whether it's walking or running or gym or yoga or whatever it is. Just find something that keeps you in motion. Give yourself quiet time to integrate what events you're doing and what emotions are going on, and just allow yourself to be at times. Learn to talk about mental health and emotions to people around you. Practice setting healthy boundaries and saying no when you need to take care of yourself. Keep in touch with friends and family who you feel safe with, and then speak up when you're struggling so that others can give you support. They found that recovery from trauma is significantly faster when people have a network of people around them. And that could be family, it could be friends, it could be a friend's family, but having a network of people around you that you feel safe with and have fun with and celebrate with can make a big difference. Slow down for 2 to 3 hours in the evenings and dim lights. and when possible, go to bed and get up at regular times. My son and I have both gone to sleep advisors or sleep experts, and yeah, they were sort of saying, hey, do you slow down in the evenings? And I realized for a long time I would try to work as long as I could during the day and then stop and then try to just go to sleep, and I'd be all revved up and couldn't unwind. And yeah, didn't understand why I couldn't sleep. So yeah, and helping to just dim lights and slowing down in the evenings can make a big difference. And also when you do go to bed and get up at the same time, consistently, your body clock starts getting used to that, and it makes it a bit easier. Now, when you have really bad PTSD symptoms, sleep does not come easily, and it's quite hard to do that. But doing what of that you can does help support getting into that cycle. Okay, terrific. So that's step 4. Okay, step 5, planning your healing journey. A drink of water. Yeah, we're running out of time, so we're almost there. Okay, everyone needs to decide what's right for them to include in their healing journey. You need to understand and consider your own mental health and medical conditions, so your healing journey will be different from mine. And yeah, we all want one thing that will heal us, but the good news is there's many ways to heal and not just one. And healing comes from several things together that start adding up and multiplying. So if you're eating well, if you're taking care of yourself, if you're doing some breath work, some grounding exercises, you're doing some creative things to release energy, if you're going to some energetic healing practitioners, all those will start to multiply and speed your recovery. Okay. And yeah, I've certainly found that going to some healing practitioners, you might go to 5 appointments of acupuncture or craniosacral therapy or massage, and give it time to compound and for your nervous system to learn to calm down, and talk to the practitioners about how you're going with it, what's working and what isn't, so that they can fine tune what treatment they're giving you. And often I found with the healing practitioners, sometimes I'd be a bit dizzy or feeling quite tired immediately afterwards. This can be because your body is integrating the change. If you've been hypervigilant and really hyped up, and the acupuncturist or the craniosacral therapist or the masseuse is calming your body down, your body then needs some time to adjust to that change. So it's good to have quiet time or to take a nap after treatment and let your body sort of integrate that. And it's usually a day or 2 after the treatment that suddenly you feel fabulous. I know I spoke to one person and they said, oh, but I don't feel right immediately after the treatment. Sometimes you don't, but allow the change to happen. So it might be, a few hours or an overnight before you, feel fabulous. Okay, lastly here, got a sort of a metaphor for a healing journey that helped me. Yeah, the best metaphor for explaining how a healing journey works is by imagining a big ship that you're trying to bring into port with a few small tugboats. And each tugboat is an energetic healing practice or a technique for managing symptoms or a self-care technique. Now, they may not seem powerful enough or effective enough on their own, and you can't move the big ship with one tugboat. You might need 3 tugboats. But each tugboat is helpful, and each tugboat is part of moving the large ship closer to port. Each nudge of the tugboats bring you closer to healing. So it's, PTSD is like this big ship, and you're slowly working to bring yourself back to being okay. Yeah, so all the techniques of breath work, of mindfulness, of the grounding exercise, the physical exercises, all those are good to begin with, and all those are sort of the tugboats that help you bring yourself back to wellness, bring that ship into port, and those layered healings, doing a bunch of those different things at the same time, really help bring you back to wellness. And yeah, I'll just stop the sharing and say hello again. Yeah, all those things compound themselves to add up to being well and to healing from PTSD and giving you back that sense of being present in the world. So thank you very much for being here. I hope that's been useful. I'm be glad to hear in comments things that have been of value. And I will send you a recording afterwards, and I'll also put this in the form of an article so that you can refer back to this if you wish. So yeah. Okay, and thanks from Roy that saying it's very helpful. Thank you for the great session. And yeah, I'm glad, Greg, to share a lot of information so that you have some different tools to deal with healing issues. So thank you very much, and I'll say goodbye.